Hello, hello.
Hi.
Oh,
It worked.
it worked. Tell everybody your name and your birthday.
Yeah, my name is Christine.
Yeah.
Birthday is January 22nd, 1984.
Oh, are you a 0 degree?
Yes.
Oh my God. Message me. You can. I have that master's group for 29s and zeros.
Okay.
So you're missing out on all the fun. What drew you to be a physio?
I knew I wanted to help people,
Mm-hmm.
and I was always into sports my entire life. And I just, from an early age, everyone's like, you should be a doctor. And I was like, no, not really knowing why. And honestly, like, I'm happy I didn't go
Yeah.
that route. But yeah, no, I remember going to a physio once when I was 14, and I was like, yep, I can totally do that. So I went that route.
That's cool.
Yeah.
So and you're in Calgary, Alberta, right?
Currently, yeah.
Yeah. Current. Oh, why is there a change coming up?
Anyways. Yeah.
Yeah, you're the Aquarius. I'm not attached to anything. Yeah. Could change tomorrow.
Oh yeah, it's probably pretty stressful for some people, but luckily my husband's good with it.
So as a physio, what are you seeing right now in people? Like what's the biggest predominant thing that you're seeing?
Last year, I will say though that people are way more open to discussions about emotions, about the psychology of pain. They're way more open to things like that. And even when I talk to them about fascial maneuvers, trauma, how it stays in your body, how it stays in your fascia and everything, very much open to that kind of stuff. So that's a positive.
Do you think that is it like is it a real shift? Like all of a sudden people are open? Is it a lot to do with you, or is it just generally you feel that people are more open?
A lot of the people that I see are in their 20s and 30s.
Right.
Yeah.
Right. Yeah. And are they connecting the fact that, hey, I've got this pain in my body,
Yeah.
and I know it's something to do with my emotions?
Yeah.
Wow, that's
Yeah.
super cool.
I'm in a young kind of like neighborhood.
Yeah.
So yeah, they're young people. I realize that I actually like working with them. I mean, I like working with everyone, but they're very receptive,
yeah,
you know?
they're this young generation, like this generation under 30 right now. They're born in they're like well, depending on when, but somewhere around 15 to 30. They're born in Capricorn, so they don't want to accept what we did. They want to find get down to the bottom line. They're looking critically and saying, okay, I bought into this already. It took my generation to like 40 or 50 years old to say, okay, I'm done.
Yeah.
Their generation is doing it at 20.
Yeah, totally. Yeah.
So what are you seeing coming in? Like what are the ailments that you can connect with, even like emotions?
Lots of stomach stuff, lots of digestive stuff. Most women all have digestive issues.
Yeah.
Headaches, lots of that. Yeah.
Is it predominantly women?
It always is.
Yeah. Well, but that has changed. If you go back, PT would have been predominantly like in when I was 30 years ago, 40 years ago, PT was predominantly men, actually.
But yeah, it's predominantly women now. Like the amount of physiotherapists who are working right now, it's mostly women. But no, you're right though. I would say there is a little bit more men showing up, but again, I think it's because of the age, the demographic that I'm seeing. Yeah.
And are they what are you seeing with things like eczema, rashes, anxiety, depression, autoimmune type stuff?
Yeah, tons of autoimmune, tons of like bloating, back pain, hip pain, like stuff that's all congested, And
so this is a good point, because you do fascial maneuvers, you've been trained in it, you've been working through it, so you're adding different things to your protocols. What would be different in like someone coming to you as a classical trained PT that's out there?
Yeah, so like even when I had So let's say someone comes in for back pain, for example. I will always address issues from the front. So all the gut stuff, the you know the area around the ascending colon, descending colon, small intestines. I took so many courses in visceral manipulation. So fascial maneuvers has been great because it's a great little, like, it's an exercise I can give my clients
Right.
to continue doing at home. And if I do any hands-on, whether it's like releasing the ileocecal valve, like I used to do that all the time for years, now they can kind of do it themselves. And I know even in the past, a lot of my clients would say, well, I can never do it just like you. And I'm like, yeah, it's fine. But even if you're kind of on there and you're not quite there, you're still doing something, So it's given them the confidence that they can just do it solo,
Yeah, and that's a big part of it, because I was having this conversation while we were in Joshua Tree with somebody. I was saying, before in the clinic, we would give them tools, we would do the work, but there was always this, what happens when we're not there?
Yeah.
And
yeah.
that overweighs that. What happens when I'm not there, when they're not in an appointment, overweighs all the stuff that I would do in an appointment.
100%. I used to always tell them I'm like a piece to the puzzle. I'm like 5% of your rehabilitation. Whatever
Right.
you do at home, what you're looking at, who you're with, what you're eating, what kind of job you have, like, are you in a toxic relationship at work or whatever? Like, that all influences, your pain and your state, right? So
You're spending a lot of time educating your patients.
a lot more.
Okay,
yeah.
So that's not a traditional PT in the physio in today's world.
No.
So do you know what the meaning of the word doctor means? What it is?
No.
The doctor is educator.
Mm.
That's why the original doctor is a PhD. We made medical doctors only been around since 1935. That was which really doctor meant I'm educating you, not telling you what's wrong and fixing it.
Yeah.
So by default, you are a doctor.
Yeah. Going backwards. Yeah.
Yeah.
Yeah. And I think also, like, pivoting forward, I'll be creating like courses so that I can just really teach people online or in person instead of always me doing something to them. Just kind of like, integrating some fascial maneuvers and some knowledge there, but also kind of spinning it my own way with all my stuff that I've learned over the years. But yeah, I just want to empower people more because I know they can do it, Like I've been just like you, Garry. I've chased the best of the best everywhere. Always feeling like, like I need to find the best this or the best that. And yeah, some of them have helped me tremendously, but ultimately I was like, no, I need to be able to do this myself,
Right. Yeah. And that's the chase. I mean, I went to the best, and then when it didn't work, I became them. And then and I got really good at it. I really did. But then I got to the top of it, and I realized, even if I'm the best of the best, I used to say I would see you, even on a full program, 3% of your week. If I'm 100% at my 3% of your time, but you're only 50% at your 97% when you go home, then this ain't gonna work.
Yeah, absolutely. Yeah.
I remember having this come to Jesus moment with myself. I had I did a lot of like end of life, critically ill at Human Garage. It was like everything else failed. Let's go and try this. And so I had this guy, and I needed him to get the stress out of his body. And it's a cancer issue, and he was older. He's in his 70s, but it was like, if you take the stress out and you take these supplements, then your body has a chance, but your body's in fight or flight. It doesn't. And, I said, I need you to do this every day for 15 minutes. I had the family there. They're all willing to do it and all this. And I'm like, he comes back, again a week later. And I'm like, so, okay, how did it go this week with your 15 minutes? Well, I got to it one day, and this came out, and I'm like, what am I doing here?
No. And this has been my frustration, because there's so much good work in the clinic, and yeah, they're motivated, but they come back and it's just like, yeah, well, I didn't want to put the time, right? So it's kind of like, what are you doing too? Because you're putting so much energy in there, right?
Right.
Yeah.
Yeah. I don't want to. That was my thing. Is it wasn't even the physical energy. I didn't want to put my heart out to them anymore.
Yeah.
Yeah, because it's
Yeah.
like I believe so much in them and their ability that they didn't believe. And you know what? You know how it manifested in me? I used to get swollen right around here, and I would go and I would be burping when I would go home. I had no idea what it was at the time. It was my stomach belief. I was giving them all my belief.
Yeah.
And they were taking it, but they weren't exercising their belief. And I would literally get swollen right around this midsection here. And it was like in my old fat pictures, which I'll show later, I had this band that was tight around here, and it was my lats would come out, and then over top of my hips would come out, and I'm like, what is that band there from? And it was like me exercising my belief.
Interesting. You know what's funny is that I have a band on my back, kind of at the same, like, kind of there.
Yeah, that's it. That's from the stomach and spleen. So the stomach and spleen, right?
Yeah. Like if I rotate a certain way, like all my muscles are just kind of bulging like over that band.
That's what it is. Yeah. That's your Sagittarius, by the way, because Sagittarius is the stomach. And it's the number 3, the color blue, planet Jupiter, the 12-year story. So that every 12 years, like, how old are you now?
39.
Whoa, you're 39?
I'll be
I thought you were like 26 or something, or 28. Yeah, okay. So if you take 39 and you go back 10 years, that's 29, and then go back 2 more, it's 27. So at 27, you were going through a story where the theme of that story is very much like the theme of your story today, either like starting a new job, doing something in a relationship, thinking something about yourself. Can you pin that?
Yeah. Okay. 2020. Yeah. I was starting a new job at a clinic. I was starting a new job at a clinic, and I quit physio right before it. I was actually going to a clinic to get treatment, and then the owner of the clinic just offered me a job because he's like, I think we're going to be a good match. And I was like, yeah, I mean, my partner at the time like was potentially getting a new job elsewhere, so we were gonna move, and then we ended up not moving, and then I accepted the job, and it was just like I fell in love again with physio.
Okay, so would that mean that right now, because of all this new stuff you're learning, you're falling in love again with what you're doing?
Yeah, because this is interesting stuff. Like I'm posting now on my my business account, my Ethos PT account there, and for years I've been stuck. I've been unable to produce anything. It felt forced. It felt like as much as I try to create something, it just never happens.
Yeah.
But like now it's definitely easier to produce, right?
Right.
And easier to share stuff. And you know, my personal account, it's private account. I can whip things up so quickly. But yeah, in business, I had such a hard time, even though I know so much.
And look at this. When we started, I said, you're in Calgary, and you go, for the moment. It means that there's some sort of contemplation. And 12 years ago, there's a contemplation of moving.
Yeah.
You see how accurate it is? That's your Sagittarius, by the way. And it happens for everybody. The 12-year story repeats itself, but you're going to feel it, and it's going to show up especially on that left side.
So my band, okay, but it's interesting. My band's on the right side, but I remember...
well, your tightness is on your left side, but if you're tight here, you're going to see it more here.
On the side.
Yeah.
True.
So basically the tightness you wouldn't see, you'd see the body expanding over the tightness on the other side. So the other side would be puffier on the right side.
Yeah, it is. And I remember, anyway, I don't need to get in there, but yeah.
Well, because it also make your left breast a little bit smaller than your right one.
Okay.
Yeah, because it's pressure on this side of the body, which means that we're a balloon, that this side has to be a little bit bigger.
Yeah. Yeah. Cool.
Yeah. So, and this, you know, it was interesting because when I stopped looking at the body as muscle skeletal, but as we call it, you know, pressure mechanics. That's the only thing I have instead of biomechanics. Because if I move, like when I got my swelling in my face there a couple months ago, that forced this area of fascia that wouldn't open up to open up. Like I tried to push it, pull it, have other people. I grab my hair, pull it here. I'm grab my ear, had somebody pulling my hair, trying to open up. It wouldn't open up.
Yeah.
Then I fell over here and it just opened up.
Yeah, totally. Yeah. I mean, honestly, like I always give fascial maneuvers to all my clients. Everyone gets something. Usually the 15-minute stress reset. And I explain to them like the pressure system and how you just need to open up the whole system first. And then you can then focus a little bit more on your trouble area. So whether it's your neck, your chest, or whatever it is up here. But personally, when I was doing them, I remember starting it and being like, okay, like I can see that. Like I was a bit apprehensive because I'm like, I've done rotations before, I've done this before, but I just kept on going. And then one day I remember I was at like, I think it was in my 28-day reset. And I remember just one day I was sitting in the hot tub outside, and all of a sudden I was twisting and rotating, like almost to the point that my chest was on the other side.
Right.
Like totally like a, what's it called?
Like
the extra, no?
Yeah.
I was like, oh my.
You're like torqued all the way around. Yeah, I remember that. I remember feeling it.
I was stuck for 15 years in my body, like 15 years. And like I was so frustrated because I'm like, I'm a physiotherapist and I still can't figure it out. And I'm going to the best of the best. And that was super empowering for me because I'm like, okay, like I can do this myself. And in a year, I think I maybe went to go see one person. I went to go see an acupuncturist, and that was it.
So that's a really important point. I mean, this is one of the things that I felt disingenuous about in the clinic. And I used to get mad. I'm fixing people, but no one in my clinic could do the work that I did. So I'm fixing people and I'm getting angry because I'm going, that's what I need.
Yes. Yeah.
You felt that, right?
So like, I'm just like trying to like hold on to like here and compress there and like all the things that I would have done with my clients. But I'm like, oh, who can do this? And you know, my poor husband. And I was like, okay, put a bit more pressure, pull it. And I'm like,
did you do it?
Yeah.
I like, damn it, come on. Yeah, you're doing it wrong.
Yeah. I'm like, yeah. I mean, he was very supportive and he tried, but whatever. I can't expect him to do it. But yeah, no, I felt the same thing. Yeah.
So let's talk to somebody who just went to a doctor. They've got some sort of issue. They've got a lower back issue. The doctor says, "Doc, I'm going to send you over to a PT, a physio."
Yeah.
Depends on where you go. It's like funny. I come from Canada. PT is okay, but it's like, or no. I learned this in the United States. PT, but PT sometimes some places means personal trainer, right?
Yeah.
Yeah. And so physio is I think in Canada they use physio, right?
No, but PT is a PT is the designation here. Yeah.
It gets confusing because so they get an appointment to their physio or their PT.
Yeah.
They've got this lower back issue. They walk in. What are some of the things that they can say practically to their physio to help move them along, because they don't have you if their physio is not doing something like fascial maneuver?
What can the doctors say?
No, what can the patient? Because if the patient they go in, I've got this lower back issue. The doctor says, well, I don't know what it is. I'll order you an MRI or an X-ray.
Yeah.
We know it's not going to say anything usually. So I'm going to give you some physio appointments. I'm going to send you in. They go into the first day of physio.
Okay. Yeah.
What are some things that they can ask for to help their journey?
I would tell them, start listing everything. Like even when I go back, okay, any old injuries, any surgeries, I always ask surgeries, C-sections, like did they get their appendix removed? Like any scarring, IUDs also. I
Right.
have a lot of women with back pain and hip pain after an IUD.
Yeah, for sure.
Tons. Like, I almost want to say, like,
It's
no.
a uterus going like, I didn't like that cramping
Yeah.
in.
Yeah.
Yeah.
I would say just like let's like talk about everything, your digestion, your stress levels. Even if you think it's like it's not relevant, just go there.
It'd be good to actually write down a list. Here's all the things that I've experienced. Here's all the pains I've
Yeah,
had.
yeah,
Because they don't really think about it at the
no,
time and put on the spot when they go in, right?
yeah, no, exactly. Like even just like for like mid back pain, sometimes I say, okay, like, do you feel full quickly? Do you have lots of like do you burp a lot? Do you have acid reflux? Like things like that. Like, did you have an old injury? Did you fall on your ribs? Like, did you fall on your side? Was there an injury like that? Did you fracture a rib a long time
Mm-hmm.
ago? Like, you know, like it's just, and even sometimes it's something totally unrelated, but yeah, it's just really starting to get them to talk about everything.
Yeah.
And even
Somebody said I put together
talk
my
about,
back pain with my IUD. There you go. That makes a big difference. Thank you for talking about that.
yeah, yeah, there's, yeah. Um, sorry, where was I going with this?
We were talking about all the things that they can say in advance, even if it's anything that.
Yeah, I would just say stay open-minded and just really think of everything, you know, like what's going on in your life, what has happened in the past, and just, you know, even if you think it's unrelated, just talk about it. And I will say, like, if you do have someone who doesn't just look at the pain and the problem, like just, okay, I've got back pain, I'm only going to look at the hip, the back, like a good therapist will look at the whole system. So either way, sometimes even if they don't tell me, oh yeah, I have a rod in my femur, I will figure it out. Like,
Right.
or they like sprain their ankle many times, I will know. I can feel it. I can see a difference between one ankle and the other, you know? So yeah, I would say just discuss everything.
So here's one. So how do you know it's not going to be a fit as a patient coming in to a PT? Like, what are some of the things that are like, I got to watch out, I need to go somewhere else?
I mean, again, like I might not be someone's cup of tea, right? Like,
But
it was
not
some,
you. No, I mean, honestly, you are doing stuff looking at it holistically.
yeah,
But like some PTs you walk in, it's like you got a hip issue, it's only in your hip. Okay, I'm only
yeah,
looking there. That's one of the things, right? If they're not asking certain
yeah.
questions.
So I will say, like, they're going to be really missing out on like what's feeding the hip. You know, do you have like an ankle that hasn't moved in a decade, and like you're going to keep on fixing the hip and then never address the rest of the leg all the way down to the foot? Like, then you're just chasing pain. And you're going to be back at physio and you're going to be back at massage and you're going to keep on spending the money like that. So I just say, like, you need to look at the whole system as a whole. Like, so that would be my big like red flag, is that, you know, if your therapist is only looking at that one little thing that's bugging you and not kind of looking above and below, yeah, that would be
So
my,
I feel, because especially as a physio, you're the last and the first line of defense. It's like they should be actually addressing you first before a doctor, technically, and then you afterwards. That's the way it should be, because a lot of stuff they wait for an answer, they go get an answer, the answer is incomplete anyways.
yeah, yeah, a lot of times that's the case. Yeah, and a lot of times people don't know that they should go see a physio. Like, it's not common sense after an injury or even surgery. I mean, more and more now you are seeing some surgeons and doctors to like refer to
Yeah.
physio after cast removal or whatever. But I mean, yeah, the bone healed, but the soft tissue is very stiff.
So
And then
oh, go ahead.
they get frustrated because they said, well, I thought like it was going to be healed in 2 months, you know?
Right.
I'm like, yeah, bones healed, but that whole rehabilitation can take months, if not a whole year.
That's a good one. It's like, because there's an expectation that's not clear to the
Yeah.
patient. Yeah, what does healing really mean? Does healing mean I have my full range of motion?
Yeah.
Does healing mean I don't have any pain anywhere in my body? Or does healing mean the bone healed?
Exactly. So it's a reframing of what healing means. And I think that there's a lot of education still to do in that aspect.
So I am a physio, okay, and I know that it's not working. I know that because if you're a physio out there and you're doing the way you're taught, there's a big gap in between the expectations of what people want and what you're taught. So what's the first step to making a transition, like your journey into like what you're doing right now with fascial maneuvers, bringing other things in, asking about emotions and
Yep.
looking at other things? What's the first part of the journey that they should do?
I say just start somewhere. Just try one thing and start kind of integrating it with every single client and see how this person responds and this person responds to it, and just also see how things work with you, right? So whether it's a modality, a new exercise, or a new way of approaching it, just try one thing and see how it goes, and also see how people, right? And see where you need to pivot.
Right. Yeah, that's a big one. It's like, test it out on you. See, because my own experience was, here's one thing that happened is I developed the fascia work and then the fascial maneuvers, but the fascia work itself, and I had never felt it myself truly until Jason and Cynthia were trained and they did it on me.
Mm-hmm.
And when it happened on me, I'm like, oh my God, this is why everybody loves it.
Yeah.
That's literally what I said, because it felt so good, because I hadn't experienced it. So a good part is to go try what you're telling people to do.
Yeah. Yes. Yeah. I think a big piece of it is educating people on like what you're trying to do, anything new that you're trying to implement, because as if they're new to this kind of stuff, they need to just kind of wrap their head around it and be like, okay, yeah, you're trying to release the fascia, or you're doing this maneuver that might look a bit funky, but it's okay. Like, this is what we're doing, Yeah.
It's really weird when it's like, yeah, here's one that I get from people when I ask them to do something. Is that safe for me to do that? I mean, if you're asking if it's safe for you to move your body, then we have a real problem.
Yeah. Yeah, there's a lot of that.
Isn't it? Yeah, it's like,
Yeah.
don't move. Don't move too much. If you move too much, you might break something.
Yeah. And already, like, you if you might tell somebody to do something every day, they'll probably, most of the time, they'll only do it a couple times a week, right? So if you tell them don't move, then they're really not going to move, right?
Yeah.
So
Yeah, it's the saying is they do half of what you do right and nothing of what you do wrong.
Yeah.
Yeah.
Yeah. Yeah.
Yeah. And it's like, it's setting the example. It's getting out there. It's trying it for yourself, and like you've done. And I've been watching your journey for quite a while. So, I've been watching how you do, and you embody stuff. Yeah, that's what's really important. You go out there, you try it, you play around with it. I can see you having fun with it now, which is really, really cool.
Yeah. That's the one thing I will say, is that I'm so open-minded to so many different things. And I was actually having this conversation with another friend of mine who's a physiotherapist, who actually sent me last year the Human Garage handle.
Yeah.
And I was like, okay, yeah, I'll do the 3-day reset. Let's try it out. I just always try everything first myself. Yeah. Always. And I'm like the guinea pig first before I start implementing it with my clients. But I always say, just try something.
Yeah.
Like, you just give it a shot. And even if you think you've done it before, you never know.
That's the trap. Honestly, that's a trap with learned people. It's like, no, I know the end result, because that simple movement of like turning the head, counter rotating, changes everything in the body. And they're like, I've already done these twisting things, but if you notice, most of the twisting things are like that without a counter rotation.
And the other piece too is that maybe you are at a different state of your life where you are now able to accept this, right? Like this same exercise, and maybe you weren't ready a year ago, right? So
good point.
Just try things out again. I mean, I would, my apprehension was that, yeah, I've done lots of rotations before, and also any rotational sports or activities would really trigger me because of an injury I had like back in 2010. And it
That's your
basically,
Sagittarius.
it's
the belief.
body. And anyway, so I remember every time I would go play golf or tennis, I would end up with a headache because everything was so tight that, like, with all that rotational movement, I would just feel so shitty in my body, and I would actually get like a tension headache.
On your left side?
No, it was the whole thing. Yeah.
Yeah, it was funny because I was bodybuilding the whole time, working at the gym, and I used to stop doing things in the outside world because I didn't want to screw up my workouts. And rotations were like, okay, I can't rotate. I knew I couldn't rotate because if I rotated, I was going to be out.
Yeah, totally. And I could be out for a week, sometimes 2 weeks. Yeah. And any shoulder press stuff eventually ended up being awful, like anything overhead, because it would just compress my body. Yeah. So anyway, I was like apprehensive about the rotation with Human Garage, but it never triggered anything. And if anything, I just have way more range of motion now.
Yeah, it's a different, and that's, this is part of what, over this next year and a half, we're going to be able to take all these belief systems and put them out in graphics and videos and explanations.
Yeah.
As you guys are taking more leadership, like you're creating a lot of social media for us, which is fantastic. And your posts are doing really well. But what that does is that gives us the ability to get off that nut of talking to people so that we can create more content that is educational. And that's really what we're moving towards. Yeah.
And I just saw someone's comment, just keep practicing. And like, that's the one thing, like, don't expect anything to be fixed overnight. It's consistency. You just got to stick to it.
Yeah.
Like, really got to stick to it.
Listen, thank you for doing all that you do to help people. I love watching your journey and how you're implementing fascial maneuvers. I can't wait to see how you bake this into your own program, because I have a feeling, and what we're looking for is people like yourself who take this, and we have a couple doctors like Dr. Christian Reddy and stuff like that have converted their practices around this philosophy, and now they're practicing in different ways. Yeah. And I can't wait to see how that happens, and we want to just highlight and showcase that.
Yeah. Well, thank you for everything you guys are doing. And yeah, it's been really great seeing you guys transition over this last year. And I've seen lots of positive changes. And yeah, it's gonna be big 2024 for sure.
It is. Now, make sure you DM me, because I'm going to put you into the Masters group.
Okay.
You're a Grand Master, of course, but you're just having a good time this time. You're not trying to prove anything. You're just out there trying to have a good time, figure it all out.
It took me like 30 some years to figure that out, but at least I'm here.
Okay. So yeah, message me and I'll put you in that group. Okay.
Okay. Sounds good.
Okay. Looking forward to seeing more. Thank you so much.
Sounds good.
Okay,
bye.
Bye. Bye.